All right, today we are diving into one of the most common gut problems out there, diverticulitis. Now, for decades, the advice was really strict. But what if I told you that for most people, the modern treatment is to do almost nothing at all? Let's get into the surprising new science behind this whole thing.
So it often starts just like this, a sharp, kind of stabbing pain that just shows up over a few days, right in the lower left part of your belly. It's the classic calling card of diverticulitis, and honestly, it's what sends most people running to the doctor. So what is actually going on inside your gut when you feel that? To really figure out where this pain is coming from, we've got to start with the basics, the anatomy of your colon. Turns out a whole lot of us are just walking around with these tiny little pockets in our colon wall. And you know what? Most of the time, they are completely harmless. Okay, imagine your colon is like the inner tube of a bicycle tire. Over time, some weak spots can develop and little pouches can start to bulge out. These are called diverticula. They are incredibly common, especially as we get older, and for most people, they cause zero trouble. Absolutely none. Now listen up, because this is the single most important difference to understand. Diverticulosis just means you have the pockets. It's a condition, not a problem. Diverticulitis, on the other hand, that's when those pockets get inflamed or infected. That's the disease. That's what hurts. And when I say these pockets are common, I am not kidding. Get this, more than half of all people over the age of 80 have diverticulosis. It's almost just a normal part of the colon getting older. So yeah, simply having the pockets isn't the real issue. So this leads to the really obvious question, right? If these pockets are so common and they're usually harmless, what makes them suddenly go bad? What's the trigger that turns simple diverticulosis into painful diverticulitis? The million-dollar question. You know, the short answer is researchers aren't 100% sure what kicks off the inflammation. The thinking is that maybe a little bit of stool gets trapped in a pocket, which leads to bacteria having a party. But while the exact cause is still a bit of a mystery, studies have definitely identified some clear risk factors. Yeah, research points to a few key things. Lifestyle choices like not getting much physical activity, smoking, and obesity, those are all strongly linked to a higher risk. And interestingly, so is the regular use of NSAIDs. We're talking about common pain relievers here, like ibuprofen and naproxen. But let's put this into perspective for a second, because the odds are still very much in your favor. Of all the people walking around with those harmless little pockets with diverticulosis, only about 15 to 25% will ever get a painful episode of diverticulitis in their entire lifetime. Okay, so you have that classic pain in your lower left belly. You go to the doctor. How do they actually confirm it's diverticulitis and not something else? Well, the process is surprisingly straightforward. It all starts with the story you tell. Seriously. The diagnosis for a simple, uncomplicated case relies heavily on this classic symptom profile, that persistent, sharp pain in that one specific spot, developing over a few days. That description alone puts diverticulitis right at the top of the list. The whole diagnostic process is usually a simple 3-step routine. First, your patient history. The doctor just listens to your story. Next, a quick physical exam to pinpoint exactly where it hurts. And finally, a simple blood test can check for something called C-reactive protein, or CRP. It's basically a substance your liver makes when there's inflammation anywhere in your body. So if that level is high, it helps confirm the diagnosis. All right, this is where things get really, really interesting. For decades, the advice for diverticulitis was super strict. But modern guidelines, they've completely flipped the script. The evidence-based treatment for uncomplicated cases is probably not what you think at all. Let's just kick things off with this bombshell of a quote from the Dutch guideline that this whole explainer is based on. Bed rest and dietary measures are not necessary. This one sentence directly challenges so much of the old school advice that's still floating around out there. So the first myth we gotta bust, strict bed rest. It's just not needed. The modern advice is simply to adjust your activity based on how you feel. If you feel like moving around, go for it. There is absolutely no reason to chain yourself to the bed. And the second myth, a special restrictive diet. Nope, you do not need to switch to clear liquids or avoid a long list of foods. The guideline is crystal clear. You can eat and drink whatever you feel you can tolerate. There's just no good scientific evidence to back up those restrictive diets for simple flare-up. And now for the biggest surprise of them all. For uncomplicated diverticulitis, antibiotics are not advised. I'm going to say that again, no antibiotics. Study after study has shown that for these mild cases, they just don't speed up recovery or prevent complications. Your body's own immune system is usually perfectly capable of handling the inflammation all on its own. But, and this is incredibly important, this whole less is more approach only applies to uncomplicated cases. A small percentage of these flare-ups can get very serious, so it is absolutely essential that you know the red flags that signal a medical emergency. So the most crucial point here is this: that less is more approach we just talked about is only for uncomplicated diverticulitis. A complicated case is a totally different animal, and it is considered a medical emergency. You need to get urgent medical help if you experience any of these things: severe pain or pain that's spreading, a really high fever, any rectal bleeding, you can't stop vomiting, or your abdomen becomes hard and rigid. These are all alarm bells that something much more serious is going on. These are not wait-and-see symptoms. No way. They can signal a major complication, like an abscess or even a hole in the colon. The guidelines are very clear. These symptoms mean you need an emergency referral to a hospital and usually to a surgeon for an immediate evaluation. So let's bring it all together. The big takeaway from all this new thinking is actually pretty reassuring. For the vast majority of people, a first-time uncomplicated episode of diverticulitis is what we call a self-limiting condition. That means with some pain management and just watchful waiting, while keeping an eye out for those red flags, it just gets better on its own. And this all leaves us with a really fascinating final thought. This shift in treating diverticulitis, moving away from routine antibiotics and interventions, it's part of a much larger trend in medicine. It really makes you wonder, as we learn more about the body's incredible ability to heal itself, could this less is more philosophy become the future for how we treat all sorts of common conditions? Thanks for tuning in.